Hello, this is Dr. Jerry Hizon, here to talk about the documentation of a patient with traumatic brain injury. As a general disclaimer, please refer to your particular doctor. This is a general course, not intended to be medical treatment, and your particular situation may vary. Symptoms of traumatic brain injury, also commonly known as a concussion, are caused by sudden damage to the brain from a blow to the head. It's not bleeding, but it's a bruise. So not bleeding, but it's a bruise. There's drowsiness. Sometimes they can have different sizes of pupil. You can have convulsions or seizures, trouble recognizing people, confusion, restlessness, agitation, unusual behavior, and loss of consciousness. Physical exam is a complete neurologic exam, also psychiatric exam, vision, hearing, screening, and labs. Testing can be history, physical exam, and then imaging such as X-rays, CT scans, MRI. Treatment is usually rest and make sure they get adequate hydration. Might be some medications and some rehabilitation therapies. Sometimes we use medications such as anxiolytics, sometimes things to help them to sleep, sometimes anticonvulsants, antidepressants, and then they may need cognitive, physical, and or behavioral therapy. Patient education is to avoid activities and remove distractions and noises. Try to slow down and do one task at a time. Allow extra time and also maybe need to use memory aids and establish and stick to a strict routine. The family needs to be rehabilitated in terms of what they need to do to help them. There may be medications and you may need to follow up with your primary care medical provider. So in documenting for the patient with traumatic brain injury, the chief complaint might look something like this. Fall with head trauma and symptoms for, symptoms of headache and dizziness and photophobia for 17 days. And so this is the typical kind of template we might use. Mr. Jones is a 22-year-old male who, with a history of, say, diabetes or something else, presents today with headache and difficulty concentrating following a fall. And it occurred 2 days ago. The onset was sudden after he fell off his skateboard. He's had a previous history of concussions. Symptoms are 2 out of 10 at rest and maybe 5 out of 10 with activities such as trying to play video games. And then these are the kinds of symptoms he might have: headache, confusion, vision loss, lightheadedness. So as a information specialist, you're going to need to go through and ask a lot of these questions and help the doctor as he asks them. There might be head pain, teeth pain, could be neck pain, and then what provocation, what makes it worse, what makes it better. And then any other associated symptoms, such like, is it tough for you to stay awake, or is it tough for you to fall asleep? And then do you have any other symptoms, and especially memory loss? Have you had previous head traumas, previous traumatic brain injuries, concussions? What meds have you used so far? What treatments have you used so far? What workups have you had? Physical exam, labs, referrals, and have you seen any specialists such as a neurologist? Past medical, family, social history, like to know if they have tobacco use, and then go through exercise, nutrition, sleep program, and then step through the review of systems. On the objective, you do a general overview of are they mild, moderate, severe distress, and go through the head, ears, eyes, nose, and throat, especially looking at the eyes. You want to know if the pupils are equal, round, and reactive to light and accommodation. You may want to do a vision exam as well as look at the fundoscopic exam, and especially look at their tympanic membranes to see if they have hemotympany or blood behind the eardrum. You may want to look for any sort of bruising around the face. There's something called the raccoon sign that goes along with bleeding. Neck, you want to see what the range of motion is. Do they have tenderness? Be careful about head trauma with neck pain because there could be an occult or hidden neck fracture. Cardiovascular, pulmonary, abdominal, especially if they've had any trauma where they got knocked out or loss of consciousness and may not know that they've had some soft tissue injuries to the abdomen. Musculoskeletal, you want to see if they have normal strength bilaterally. And then neurologic, we'll look at cranial nerves. There's 12 of them. You look at strength, sensation, cerebellar things, which are balanced, especially Romberg, and one called the BESS, B-E-S-S test. And psychiatric, you'll look at do they have normal thought process. Sometimes it's very easy for them to get depressed. They may have suicidal ideations, homicidal ideations, and other sort of problems with attention and with concentration. On the assessment and the medical decision making, you have to decide, is it a simple or complicated case? Does it require straightforward or complex decision making? And the medical decision making aspect is where the provider and doctor can decide and give rationale and reasons for why they want to treat a certain way. These are the types of ICD-10 codes you might be using. So it's an S code, SO6.2XOD, which is diffuse traumatic brain injury without loss of consciousness. And again, these are very complicated, good to work on to get them right. Straightforward, just straight concussion would be SO6.0. Plan and treatment is lifestyle modification, medications, balance exercise like you see in this picture where they're practicing their balance, and then regular follow-up with your primary care physician, and then sometimes specialty consultation. Pearls and pitfalls: if there is any symptoms that are on one side or the other, get the correct affected side of the patient. It's called laterality. Document all previous treatments. Look at the various questions that you're going to need for someone with concussions. Any questions, ask your provider or doctor so that you can get the documentation exactly correct. And in primary care, make sure you document the quality measures such as the prevention type things like colonoscopy or mammogram. Takeaway points: dizziness and traumatic brain injury is common. The treatment depends on determining what the underlying disorder is. It's important to rule out any underlying conditions, especially traumatic brain injury that causes intracranial bleeding or some sort of mass that might need surgery. Study hard to learn the various questions to help document and to make sure you get all the quality measures. And again, we appreciate all that you do, because while doctors save lives, medical informatics specialists save doctors. Thank you.